Before we begin, I'd like to take this time to acknowledge that we are gathering here today on the treaty territory of the Mississaugas of the Credit First Nation, and before them, the traditional territory of the Haudenosaunee, Huron, and Wendat. We also acknowledge the many First Nations, Métis, Inuit, and other global Indigenous people that now call Mississauga their home. At this time, I'd like to further acknowledge the attendance of some of the following individuals, some of whom you'll be hearing from this morning. Chief Nishan Duryappa from the Peel Regional Police, Mr. David Smith, Chief Executive Officer of the Canadian Mental Health Association, Peel Dufferin, the Honourable Prabmeet Sakaria, Member of Provincial Parliament, Brampton South, and Associate Minister of Small Business and Red Tape Reduction. Mr. Ron Chatta, Chair of the Regional Municipality of Peel Police Services Board. Mr. Rudy Cassetto, Member of Provincial Parliament, Mississauga Lakeshore. Mr. Martin Medeiros, Councillor, City of Brampton. Ms. Rowena Santos, Councillor, City of Brampton. Mr. Paul Vicente, City of Brampton. Thank you all for taking time out of your busy schedules to be here with us this morning. In addition to these dignitaries, there are a number of tremendous individuals in attendance this morning whose hard work, dedication, and commitment to community safety and well-being have made this announcement possible today. These individuals represent the following organizations: the Peel Regional Police, Canadian Mental Health Association, Peel Dufferin, our health partners in the province, William Osler Health System, Trillium Health Partners, Peel Children's Centre, and Services and Housing in the Province, also known as SHIP. So back in May of 2019, the Honourable Prabmeet Sakaria announced funding to support the implementation of Mobile Crisis Rapid Response Teams, otherwise known as MCRT, in Peel Region. MCRT is comprised of a frontline police officer partnered with a frontline crisis worker responding to priority calls for service involving mental health and addictions-related crisis. As you will hear from our chief, these calls for service have steadily been on the rise, not only in Peel Region, but across the country. MCRT teams are an effective way, as demonstrated across the province, to help better resolve these calls for service by connecting these clients to community-based resources rather than bringing them to an emergency department. On January 13th of 2020, Peel Regional Police and our partner agency, CMHA Peel Dufferin, launched our first 2 MCRT teams. We have committed as organizations to deploy 2 cars per day from 12 noon until 12 midnight, 365 days a year. You will soon hear from Chief Duryappa the successful results of the first month of this partnership. At the conclusion of our guest speakers, we will have an opportunity to have a question and answer period. In addition, both of our MCRT teams are here today, and they will be available to speak with the media on a one-to-one basis. A media release will be issued at the conclusion of this news conference, and it will include links to all of the information provided today. A full video of this conference will be available on the Peel Regional Police YouTube channel that can be accessed from our website. So at this time, I'd like to turn the microphone over to Chief Nishan Duryappa of the Peel Regional Police.
Thank you very much, and I appreciate everybody coming. We also wanted to acknowledge our MPs, Iqra Khalid and Mr. Sidhu. Thank you so much for coming, for your support too from Brampton South and Mississauga and Mills. And at this point, I just wanted to kick this off. Now that we had a little bit of a backgrounder by Inspector Gormley, is that we have a really strong opportunity to build some resiliency in this community. And what we have seen in policing, and I can tell you from day to day, I've been here 5 months and spent a lot of time in my first 3 months on the front line with officers. Saw all 40 shift parades, and I can tell you statistically probably 80% of what they do is non-criminal. Despite the fact that there's a lot of activity in this community, we see the impacts of their time, resources with individuals that are suffering from whether addictions, social disorder, mental health. And when we think about what happens 24/7 is the people available to call are frontline emergency responders. And I need to tell you that our officers, as well equipped as they are, aren't always the best equipped to deal with mental health and addictions. We know that already. The opportunity for us to resolve these issues and provide services for individuals that is what they need versus coming along with us all the time in a cruiser is a significant change in activity for us to commit to. So I'm excited that we have the MCERT announcement. I want to thank the province and the federal government for their continued support for our municipality. I know through our partners and David Smith and the remarkable individuals at CMHA that we have the opportunity here in Peel Region to ensure that our model of crisis response, the continuum, not just in crisis, but out of crisis and aftercare, can be the platform and the example for this entire country. And we're starting with this initiative here and many other good works that CMHA is doing. I just wanted to share with you some statistics that we have researched from Mental Health Commission of Canada, that 40% of people suffering from mental health illness have been apprehended at least once in their lifetime. And 40% of the encounters between police and persons with mental health are completely unrelated to criminal conduct, which is an interesting thing. As a chief, I recognize, and you will hear probably from our Police Services Board, that we see individuals take a photo of 16 to 20 cruisers parked outside of one of our hospitals. And I do need to acknowledge that a large amount of time and resources spent caring for individuals. We are the 24/7 people to apprehend an individual in crisis. And in 2013, we had roughly over 4,000 mental health apprehensions by Peel Regional Police officers. In 2019, we approached almost 6,000. So that's a 34% increase in that period of time. What that translates for us is that about 16 times a day, 2 officers each time, we are taking an individual under the Mental Health Act to one of our local hospitals. If you can imagine as a citizen or resident or business community here, what the impact is on that individual to go with us to get help, or what the impact is on the rest of the community that still needs our services while we are there, you can understand why this is such a great initiative. Since this last month, where the Mobile Crisis Rapid Response Team has been in place, we've seen, and you've seen the statistics here, which are quite remarkable. In the absence of MCERT, 90% of the time, the police officer is taking somebody to the hospital. And we know we're there sometimes up to 5 hours, 2 officers at a time, where the clinician has an opportunity to see the individual we brought, only to see them, leave the hospital and get referred to care. And maybe sometimes they shouldn't have been there. Our officers do their best with the tools that they are provided. However, to have a trained crisis worker with us that speaks the language, understands diagnosis, can have those dialogue with individuals in crisis, we can see the impact that we've resulted in 28% apprehensions. And what that means is that 28% is getting to hospital because they need to be there, and they're likely going to enter care too, which is the next statistic, which I'd love to be able to share, but most of them are staying there because they need that help. So we're getting the right care to the right people. It's not just about how officers' time is used, but the outcomes are so significantly better for people in our community. We know we will see these individuals perhaps again. They may be seen by their physicians, by fire, by our paramedic services, but what we're doing is building resiliency in a community. No longer can policing see and do things that are traditionally done the way it was. Upstream opportunities for intervention and risk mitigation are going to be the tenets of what Peel Regional Police do. And we know that there are many programs such as this already in the province. I just want to say thank you to our funding sources for the ministry, the support of our elected officials, both municipal, provincial, federal, and of course our partners at CMHA. We know we couldn't do this without your vision for how to build a resilient community here. And I do need to acknowledge that it also is done with our partners in the hospital streams. Both Trillium and Osler have a real commitment to ensure that our transfer of care protocols are enhanced and that all interaction points are for the best of the individuals that come into our care. So welcome today, and thank you for being here for this announcement.
Thank you very much, Chief. I'd like to invite Mr. David Smith from CMHA PL Dufferin to the podium.
Good morning, everyone. So this is amazing for us. We've been working on trying to get a mobile crisis rapid response team in Peel Dufferin informally for many years and very formally for the last couple. So to see it actually in place is incredible. And then when you see the statistics that the Chief just talked about, you see that we're actually making a difference in people's lives. I wanted to take a moment just to thank those in funding, in our government partners who helped us to create this program and get it off the ground. I want to thank the police for being incredible partners. The emphasis on the good of the client as opposed to saving police hours or some of the other benefits that come along has been incredible. And to see officers reminding us that it's not about money is really, really good. I also want to thank the hospitals who have been great partners along the way. It was actually a meeting of the two hospitals, the police and ourselves, a few years back that started all of this. And the work that's being done on transfer protocols to take that even further is really incredible. And finally, I want to thank the staff that have made this happen, both on the police side and on the mental health side. If any of you were here a month and a half ago and saw some of the training that people were going through. This is on top of, many people have years and years of formal training, years and years of experience, but then to see them going through actual live scenarios. How does a police officer who one explained to me, a police officer looks big and backs away, and crisis workers look small and move in. And to see how those two work together was really incredible. It's almost like a game of doubles tennis as they sort of figure out when one approach is better and when the other approach is better. And I wanted to finish, I asked last night if I could get some of the stories that are behind these statistics to try and understand what really happens to people. So if you think that in the past 90% or for those that are still being seen by regular police teams end up in the back of a cruiser going to the hospital 90% of the time. And now 28% of the time, that still needs to happen in some cases, and it does. But the other 72% of the time, those people are receiving safety plans, they're getting connected to community resources, they're getting next day follow-ups, and instead of that experience of being taken to the hospital in the back of a cruiser and then often released back into the community, their experience is that of help and support and resilience. So I want to say incredible program, great partnerships, and I want to thank everybody involved for helping us to get to where we are today.
Thank you, Mr. Smith. I'd like to turn the podium over now to the Honourable Prabmeet Sakaria, Member of Provincial Parliament.
Good morning, everybody. Thank you very much for having me here today to be a part of this. I'm joined by my colleagues, MPP Rudy Cazzetto, as well as MPP Natalia Kusendova, who have been absolute champions on this project. I want to take an opportunity to thank all of the elected officials here today from our federal government and our municipal partners from Brampton and Mississauga. I really think a big part of making projects like these so successful is a collaboration between all levels of government, because we know when we have issues like mental health and working with policing, these are issues that transcend any political lines. This is about making great work happen right here in the city, not only in Brampton, but the region of Peel across Mississauga. I also want to take the opportunity to thank Chief Nish for all the work that he is doing and the transformative approach he has been taking to tackling many of these issues that we are facing right in the community. I also want to recognize the chair for Peel Police Board, Ron Schara, for his support and for always being a strong advocate for the community here as well. And I also want to take the opportunity to really recognize the great work that CMHA is doing, not only in the community across the province, but helping the government and helping put together programs such as these that will really make an impact, and we're seeing the impact of it. You know, just a couple of months ago, Minister Jones and our colleagues, MPP Cazzetto and Kusindova, had the opportunity to make this announcement of over, for CMHA it was about $2.3 million, but specifically for the MCERT team, we announced about $1.5 million. And I'm pleased to see that the success of this program by the stats, from 90% to 28%. That's incredible to see the work that is happening already in just a short period of time since launching it. And I think these opportunities like this really give us the ability to continue on this path. Our government has made a historic commitment to ensuring that we put $3.8 billion into mental health over the next 10 years. And it's great to see programs such as this with the partnership across not only different ministries, but different community groups coming together and working to solve so many of the issues that we continue to face. So we just wanted to keep it brief and encourage you to keep doing the great work. Myself and my colleagues will continue to be champions for projects like these and continue to support the great work that you are doing across the Peel region, and we look forward to the great results that will continue to be there. So thank you very much for having us here today. Thank you for your leadership, and we look forward to continuing working together in our relationship. Thank you very much.
And our final speaker will be Mr. Ron Chatta. Mr. Chatta is the chair of the Regional Municipality Appeal Police Services Board.
Thank you, Minister Sarkaria, for adjusting this microphone for me. Good morning, everyone. It's my honor on behalf of the board for this morning to be here. I want to take this time to thank the Ontario government and all our other partners, whether that's municipal or federal, for providing the funding, especially to the provincial government, for us to launch the Mobile Crisis Rapid Response Team in Peel. Normally, we have seen, as Chief Duriappa indicated, that we have seen the frontline officers spending quite a bit of time in the hospitals. And with this team, we will have a team ready to respond to these crises. And I want to thank, on behalf of our board, to Chief and CMHA Peel Dufferin for taking the lead on these initiatives. As we all know, that Chief Duriappa is here for about 5 months. Roughly around 5 months back, our credible board had this mental health crisis as a priority, and we are so pleased with the leadership of Chief Duriappa, especially in regards to this. Again, everyone has spoke quite a bit, and I guess it's better to be short and sweet. Thank you. Thank you very much, everyone, for being here, all the provincial MPPs, 2 MPs, and our 3 wonderful regional appeal councillors. Thank you so much.
So that concludes the formal speaking portion, and at this time we'd like to provide the opportunity for any questions that the media may have. Sorry, there's a microphone at the back there if you'd like to, or you can speak loud. Sure.
Sabrina from the Sun Newspaper Guardian. Is this MCERT team working in all 4 divisions?
Chief, did you want to come up and address that?
Sure. So, and I got to adjust the microphone back the other way. Somebody took the phone book from here. Hi, Sabrina. Thanks for the question. It is operating across the entire region. The officers and the crisis workers, which I must say are a remarkable team, and I fail to acknowledge the whole, crew of individuals at the back in uniform and the ones that aren't in uniform from CMHA that are here to make it happen. They're the ones 24/7 that are actually doing this work, and it really, the acknowledgement doesn't go to us. I just need to put a fork in that, is that there's real people along the way that have had the vision, that have seen this happen successfully in other municipalities. So to answer your question, it does cover the entire region. They start from 2 different nodes. So in 2 different divisions where they start their shift physically, they have to begin somewhere, but they have the ability to travel. They get dispatched when the crisis call, 911 call comes in, or whatever the crisis might look like across the region. The statistics, I think it keeps vacillating between the different slides, but you'll see the number of apprehensions per division. If not, we can get you that data for sure in the last month.